Hi everyone, my name is Kayla Reifel and I'm a medical student here at UMKC. Our project today is improving breast cancer related lymphedema detection, creating a standard practice for preoperative arm measurements. So I want to begin today by giving you some background information on breast cancer related lymphedema. This is a type of lymphedema that occurs after lymph node surgery or radiation due to the lymphatic damage and destruction. It's characterized by marked arm swelling and heaviness, and it develops in approximately 20% of female breast cancer surgery patients. So a crucial step in proper diagnosis, management, and improved outcomes is obtaining baseline arm measurements prior to surgery. So while the National Accreditation Program for breast centers lets each program determine the best way to implement lymphedema detection in their practice, the National Lymphedema Network recommends that every patient receiving lymph node surgery should have these preoperative arm measurements. And studies show that 40 to 50% of patients without preoperative arm measurements who develop lymphedema are misdiagnosed. So it's crucial to have this kind of surveillance in a lymphedema surveillance program. And then when we examined the patients at Truman Medical Center and University Health in 2019, we discovered only 38% of axillary lymph node dissection patients and 30% of sentinel lymph node biopsy patients, or combined 35%, receive these important baseline measurements. So before we explore the quality improvement measures, I want to take a minute and explain how we obtained the 2019 data. So we obtained a list of breast cancer patients receiving lymph node surgery in 2019 from the cancer registrar. It included 58 patients total, 13 of which received axillary lymph node dissections and 45 received sentinel lymph node biopsies. So then we performed a detailed chart review of all 13 axillary patients and 10 randomly selected sentinel lymph node biopsy patients to determine our 2019 rate of preoperative arm measurements. We did exclude 2020 data due to disruptions from the COVID-19 pandemic. So now I'd like to explain a little bit about how we determined the root cause of the low percentage of patients receiving these measurements at our institution. The Truman Medical Center University Health Breast Program Leadership Committee performed a root cause analysis using a fishbone diagram as seen here. Just to provide some context, previously patients would receive a referral to occupational therapy for these measurements, but it was noted that they had a difficult time keeping their appointments. So in July of 2018, an advanced practice nurse was trained to do arm measurements in the clinic. But implementing this was spotty as seen by our low percentage rate. So we identified the root cause this far in the program's development as a lack of standard practice. So we sought to improve this percentage by designing a standard practice that has two parts. The first part includes identifying eligible patients by a breast nurse navigator. And then the second part, as you can see on the bottom of the diagram, is taking the arm measurements at the initial appointment with the breast surgeon, and that's done by an advanced practice nurse. So our hope is with both of these things to improve our rate of preoperative arm measurements. And our specific aim of this project is to double the rate of baseline arm measurements in breast cancer patients undergoing lymph node surgery to greater than 70% by February of 2022. And while our data collection is ongoing, we did look at all of the patients who had nodal surgery or plan to have nodal surgery since implementation, which is about 2 months of data. This includes obtaining a list of patients from the cancer registrar and performing a detailed chart review like we did before. Our methods this time though were slightly different than our pre-implementation collection methods, just because we counted every eligible patient this time, whereas previously we chose a random sample of patients. So we then performed a chi-square test to compare the differences in rate in 2019 versus 2021. Okay, so this chart compares the rate of preoperative arm measurements pre-implementation on the left and post-implementation so far in 2021. So as you can see, in 2019, 8 out of 23 patients, or 35%, received preoperative arm measurements. And so far in the 2 months of data that we have, 6 out of 6, or 100% of patients have received these arm measurements. So to summarize the results, analysis of our available data suggests that adoption of the standard practice has significantly increased the preoperative arm measurement rate at Truman Medical Center and University Health. And while the results thus far are promising, the data are limited due to our small sample size because of this new implementation. So our future plans include continuing to analyze the data until February 2022 and meeting again with the Breast Program Leadership Committee to discuss challenges that they noted or unintended consequences as seen by the clinical staff. So our hopes with this is to provide a useful model that offers excellent care to our specific patient population and hopefully will be of use to other safety net breast cancer centers. And I'd like to thank Dr. Ahmadiyeh for her knowledge and support of this project. And I would also like to thank the staff at the Breast Health Clinic for obtaining the patient data for us and implementing this new standard of practice. Now I'm open to any questions.
Great. Well, we're waiting for questions to come in. Can you comment on what made you think about this project idea?
So I had reached out to Dr. Ahmadiyeh for any potential research project, and she had noted that this had been something that needed improvement within the breast program here at Truman Medical Center. So it seemed like a reasonable thing to try to improve on.
All right. From Nick Clark, great work. Love that your team was working to target misdiagnosis/overdiagnosis. It may be early, but has there been a change or reduction in the rate of post-op lymphedema now that patients are getting pre-op measurements?
Yeah, so I'm not sure yet. I think it is a little too early to tell, but that is definitely something that we will look into later on in the project towards the end of it.
And I'm curious if you guys, with this next phase, are looking at ways to recruit more participants for your study, or are looking at ways to increase the number of enrollment eligible patients?
I think you cut out a little bit for me. Do you mind repeating that? Sorry.
Are you guys looking at any ways to increase the number of patients you capture in your study?
Not currently, just because it's very specific to patients that are receiving any breast cancer patient that's receiving lymph node surgery. So it just depends on what kind of patients are seen in the clinic and if they end up needing axillary lymph node dissection or a sentinel lymph node biopsy. So it's kind of specific to those two patients.
And then another question from Dr. Reddy. Very high caliber work. What specialty do you plan to pursue?
I actually don't know yet. I am interested in surgery and in breast health thanks to Dr. Ahmadiyeh, but I really don't know until I start doing my rotations.
Okay, fantastic. Well, thank you very much for your presentation and your hard work.
Thank you.
I just wanted to make a comment as Dr. Ahmadiyeh. I wanted to thank everyone at the medical school for the curricular changes that we heard about earlier, because Kayla Reifel really, she brought the fishbone diagram to our breast program leadership committee meeting. She really brought a lot of that knowledge with her as a student and contributed to this project. So I want to thank everyone on the medical school side for really educating the students in that way and allowing us to have such a fruitful partnership.
Great, thank you for that comment. And thank you for your mentorship. And thank you to all the presenters, and Dr. Badidri says, I'm very impressed with the quality of our work and our learners, both residents, fellow students, and thank you to all the faculty mentors.